Bring your attention here. On the back. Good. Perfect.
Hi, I'm Dr. Matt here with Momentum Health Center. This is our patient Megan. We just finished going over her assessment where we checked, ranges of motion, trying to figure out how her body was moving. We try to gather some baselines because we're going to come back to a lot of these numbers, a lot of these movements as we kind of progress through her care. So the next thing that we're going to do here is take some x-rays because we really want to see what her posture and her alignment looks like underneath it all. So we'll go ahead and come over here, Megan. Okay. We'll take 2 x-rays here. We'll do one of the front of the neck and upper back, and we'll do one from the side. Okay? So you're going to back up here, back against the board here. All I need from you is just a nice, normal, neutral, relaxed posture. Okay. This light will come up to just underneath the eyes here. All right, Megan, for this first picture, we want the teeth out of the way. That way we can see the upper few vertebrae in our neck. So on the count of 3, all I need you to do is just open your mouth and hold it open for me, okay? So on my cue here, 1, 2, 3, open and hold. Okay, you can go ahead and relax. I'm gonna have you turn and face me this way. This time your shoulder's gonna be up against the board here. Again, nice, normal, neutral, relaxed posture. That looks good. And then for this one, Megan, no special instructions, just nice and steady. All right, Megan, go ahead and hold that position. So that's good. Then I'll pull something up here, and then we'll go over them. We're here with Megan. Now we took her x-rays. We put them through our analytical system, posture ray, where we mark up patient alignment of each individual vertebrae. And then what that posture ray will do is it will put it a side by side from what we consider to be a textbook normal picture. And then over here we have our patient Megan. So we can kind of compare and contrast what Megan's spine looks like compared to an ideal picture. All right. So what we're looking at when we're looking at this neck from the side is when we see this normal picture here, this green line shows us an ideal curvature, which should measure 42 degrees. A few other things that we see through here which make it normal is we have the head positioned directly over the shoulders. A lot of patients have forward head carriage, which comes on from poor posture, spending too much time on the phone, computer, driving, looking down. And what happens over time is that retrains our ligaments to carry our spine in a different position where the head is now carried in front of the shoulders, creating more weight and tension on the lower portion of the neck, upper portion of the back. This could also be where tension headaches spring from. So when we look through here, we notice that this green line shows us where the head ideally should be, and this red line is showing us where Megan currently carries her head. All right, so the numbers on here show us that she's got about 1 inch to 1.25 inches of forward head carriage, which means her head, instead of weighing about 10 pounds, is now carrying it at about 20 to 25 pounds. So that compounded day after day, month after month, year after year has led to some sped up disc degeneration right down through here, most notable at that disc level between C5 and C6. When that C5 and C6 disc or joints become compressed, that can now refer pain down into the traps, the mid-back, areas between the shoulder blades, which is exactly where she's having some of that pain as well. Some of the other things that we're seeing through here as well are how this disc degeneration, what can happen then is that will start to speed up over time unless some of these things get corrected. In terms of posture, posture is one of those things that it just continues to get worse on its own unless you're doing things to correct it. Megan's a younger, healthier individual here, so we certainly don't want her to see or see her spine decompress at the rate that it degenerate at the rate that it has been. So part of our care will be to how do we close this gap, improve posture through posture corrective exercises. We want to strengthen and stabilize areas of the neck, but also wake up some muscles that have kind of been dormant due to overuse of phone. She's also a student, so a lot of time studying, reading books, and things like that. We'll take a look at this other picture through here, and this is a view from the front. Okay, so we call this AP. What we see over here, again, this normal shows us that all the vertebrae are in alignment. All these spinous processes, which are these bubbles through here, are all right in the midline of that box, which is the vertebrae, showing us that posture and everything is perfectly up and down. So we know that Megan, she's got a little bit of a scoliosis. So her normal is going to be different than an ideal picture perfect normal over here. So we can see some of that lateral curvature through here. And what we see in this offshoot up here where Megan's red line is in comparison to that green line is all compensation from some of this lateral or scoliotic curvatures that we see in this upper and mid thoracic spine through here. All right, so this shows us that things aren't symmetrical. Her joints are positioned differently, and that's why she's got different amounts of muscular tension compared to other sides of the body. So with this, we want to make sure that we're doing a lot of unilateral work in order to make her spine more symmetrical. We're not really looking to fix any of the curvatures, but rather to make her more comfortable with day-to-day tasks, reading, driving, community school, studying, but also, being a productive team member at our office here.
Hi, I'm Dr. Mike from Momentum Health Center in Arlington Heights. We have Megan here. She's one of our patients, but also she does work for Momentum Health Center, so that's even a bonus there.
Yeah.
So we went through her treatment plan already, got her some x-rays. So we wanted to customize a plan just for her. She does have some different ailments going on. She has some different pains and aches, and she can explain that to you. But just getting her on the right track to make her whole body functioning properly is what our goal is. Not only do we do traction, not only do we do adjustments, we also do functional movement here. And we make sure that we're giving you the specific, or giving her the most specific exercises and the most specific tractions possible to reduce her pain, but also to help her function in life for the rest of her life. So I'll let Megan tell you exactly what's going on with her, and then we'll get her adjusted. All right?
Yeah, so I have pretty bad scoliosis. I have big curvatures in the top part and bottom part of my spine. Kind of looks like an S. I get pretty bad chronic back pain, especially towards the nighttime. It's like a dull aching pain, so it's great that I work here, get the perks, let them work their magic, and yeah.
So can you describe on how the adjustments have helped you and how the functional movement has helped you, just with the pinches and pains in your neck and shoulder?
So the functional movements, like the PT that we do here, has really helped me stretch out and loosen things up because I feel like I've been very tense. So that's helped a lot. As for adjustments felt great. It's just an immediate relief for me. I will deal with pain pretty consistently, and to just get adjusted and then feel that instant relief, it's been great. It's like just the biggest relief I can ever have.
All right, so we're going to check her on the table now. Every time a patient comes in, we want to make sure that they are getting adjusted. What the adjustment does is it lines the spine, so it lines up your spine so that there's no pressure or tension, or less pressure or tension on that nervous system. As we know, the central nervous system runs the entire body, so we want to make sure that there's no impingements on that nervous system. So we reduce that subluxation, meaning reduce the individual vertebra from attacking those nerves and decreasing that inflammation to, one, help with the pain, but not only help with pain, to actually increase the whole function of the body. Every cell, tissue, and organ is actually controlled by that nervous system, so the less pressure, the less tension on that nervous system, the better off everybody's going to be. So I just want to get you face down here, Megan, and we'll take a look. All right, so what we're doing specifically is we're going to check her legs. And when we check her legs here, we want to make sure that they're all even. If they're not, we know that there is some of that subluxation or misalignment of the spine. So we see here that her leg is about a half an inch shorter on the right side than the left side. That means there's going to be some rotation of those hips. Want to make sure those hips are unrotated so that, one, she gets a stable base in her pelvis here so that when she's walking, when she's exercising, that nothing's going to crumble. Because if we don't, if we're walking crooked, or if the pelvis isn't aligned, it's like building a house on a bad foundation. Yes, you can build that muscle, you can get fit, but if it's a faulty foundation or if that pelvis is crooked, what's going to happen is the body will start to compensate and eventually it will crumble. All right. When we go up the spine here, she does have a scoliosis in the middle portion of her back. And what starts to happen is you can see there's a bit of rounding here on the right side. What we want to do is just kind of loosen up this area here. And then you see that there's a lot of tension in through that thoracic spine. So at this T5, T6 area here, and we're going to get that adjusted. Have you take a deep breath in and let it go. Good adjustment. There you go. What she's going to do, she might feel some of that popping or cracking. What that is just those nitrogen gas bubbles in there. But what we're doing is we're actually correcting some of those individual subluxations throughout the spine. And that's going to start to reduce that inflammation of those nerves and then increase the function of the entire body. Right in there, huh? Mm-hmm. So in her lower back, L5 and S1. We also see this on x-ray, so we're going to get specific. We make sure that we look at it on an x-ray, and then we also palpate and see what kind of movement those individual segments. When it's fixated or stuck, we want to adjust that segment on your side facing. Straighten it out. Bring your attention here. On the back. With that L5, S1 area, that vertebra, when that moves posterior or backwards, what it can do is it can pinch those nerves, and those nerves go all the way down your legs and into your feet. So we can see sciatic pain, numbness, tingling into the legs. We can see that the glute pain, so if it's just a sharp shooting pain into the glute area, that's all coming from that lower back. It's not necessarily hip pain all the time, but if there is degeneration of that lower back, or if there is that subluxation, it can radiate that pain down the leg or into the glute. And then we're going to check her neck here. Like we said before, what we're looking for is those subluxations, rotations, or backwards movement of the spine, and we want to make sure that we're getting those adjusted. Good one. Good adjustment. And then we're going up to that C2 vertebra here. Perfect. Let's flip you back over. So we always want to recheck, make sure that her legs are back into alignment. Because if they're not, then we need to recheck the whole spine, and you can see that those legs become back to even. And every adjustment that we do builds onto itself, so they're going to hold for longer periods of time. Just like anything else, consistency is key to any kind of care and to any kind of thing we're doing with the body. Come on up. How'd you feel?
Amazing. That felt so good.
All right.
It was great.
Come on and check us out. Please subscribe to our page, our YouTube page. And if you click the link on the bottom, it'll take you directly to our website. And just come on in and see if we can help you.